afternoon, and thanks for joining us. I'm Judy Simpson. As we age, our bodies change. No kidding. Hearing loss due to aging is a common condition that impacts many older adults. So to learn more about hearing loss and the treatments and devices that can help, we've called on an expert from the University of Vermont. Elizabeth Adams is a clinical associate professor in UVM's Department of Communication Sciences and Disorders, and she's also a licensed audiologist. Welcome. Thanks so much for coming in. I have a million questions for you.
I'm glad to be here.
How common, first of all, is hearing loss?
Hearing loss is very common. According to the American Speech Language and Hearing Association, it's the #1 communication disorder in the older population. And we estimate about 2/3 of individuals over the age of 70 experience some degree of hearing loss. It's the third most common chronic condition that older folks experience, third after heart disease and arthritis. And as the population in the country and certainly within the state ages, we anticipate that hearing loss is going to become even more prevalent. And so we think about hearing loss as a health issue, and we want to think about it as a public health priority as well.
Mm-hmm. And so what are some of the myths about hearing loss?
The myths. One myth is that people think, I'm getting older, I should expect hearing loss. It's a natural part of the aging process. And while we do know that people who are getting older are more likely to experience hearing loss, we don't ever want to think about hearing loss as being normal. There's no such thing as normal hearing loss. Any degree of hearing loss can impact communication and interaction with others, and so we want to make sure that we treat it if we identify it.
And so what are some of the signs that hearing loss may be present?
The first sign typically is speech understanding decreasing in the presence of background noise. That's the most common complaint that we hear when individuals come in to see us.
So it's hard to hear a conversation if there's a lot going on in the back, TV's on, or you're in a crowded space?
If you're in a restaurant, if you're at a party, a cocktail party, any sort of social environment where there are a lot of people talking, you have a harder time understanding the one person or few people that you want to hear. You also may feel like people are mumbling. That's a common complaint. And if you feel like you're telling a lot of people that they're mumbling, there's probably a good chance that it's not mumbling necessarily. People who come into your house and make statements about your TV being too loud, difficulty hearing and understanding speech on the telephone, all of those are signs that you might want to follow up and have your hearing assessed.
You know, it sounds a little funny. You'll say, oh, you know, your hearing's going, you turn down the TV set or it's too loud. But there really are some very significant ramifications of hearing loss. I mean, it's serious.
It is serious. We have known for a really long time that there are some significant psychosocial effects of hearing loss on individuals. It causes people to begin to isolate themselves, choose not to participate in activities that they once enjoyed. There's more of withdrawn nature, feelings of loneliness, depression as a result of hearing loss, embarrassment because that person's having a hard time understanding and may respond to something in an inappropriate manner. Mm-hmm. So yeah, it really does affect all aspects of an individual's life.
It's very frustrating.
Mm-hmm. Very frustrating. Frustrating for the individual with hearing loss, but also very frustrating for those around them, loved ones, family members. Usually it's the family members who start to experience those frustrations first.
Have to keep repeating yourself.
Yep, exactly. And they often are some of the primary motivators of getting someone to seek treatment.
Are there ways that family and friends can help someone with a hearing loss other than to say you need some help?
Yeah, really thinking about communication and setting oneself up so that it's more easily to be an easier way to understand that person. Make sure that you can that person can see your face. Make sure that you are close to them. If you're in a space where there's noise that doesn't need to be there, like a television that's just on, mm-hmm. turning the TV off so that it's easier to understand.
And should the identification and treatment of hearing loss be more of a public health priority, do you think?
Absolutely should be. I talked about the psychosocial effects of hearing loss. But there's been some interesting research that's come out of Johns Hopkins University. Dr. Franklin and his research team they found some interesting associations with hearing loss, physical and cognitive decline that is associated with hearing loss. Memory declines are seen. We see individuals at a higher risk for Alzheimer's disease.
Really?
Yes, very interesting. People who have a mild hearing loss have, what the researchers found is they have a 2 times higher likelihood of developing Alzheimer's. People with moderate hearing loss, a 3 times higher likelihood, and people with a severe hearing loss have a 5 times higher risk of developing Alzheimer's. So this is definitely information we want to be aware of. Physically, that research team has found that individuals are at a higher risk for falling because the hearing and the balance portions of our system, of our body, they're connected. And so when you have a problem with one, hearing, you might have a problem with the other, balance. So that can put a person at higher risk for falls. We think about medical expenditures, and we see that hearing loss may be associated with a higher amount of medical expenditures as a result of more office visits, more outpatient visits, more emergency visits. The falls piece comes into that, but I think it also has something to do with the fact that when you have someone who can't hear very well, they're sitting in their physician's office and they aren't getting the complete instructions because they're not perceiving everything.
That's scary.
It's very scary, and so they may be following instructions incorrectly, and it can have some pretty serious negative impacts.
And so why is it so hard for people to admit that maybe they have a hearing problem, or their hearing is starting to go, or there's any problem with their hearing? Is it they just don't notice, or they just don't want to notice?
I think people who have difficulty hearing, they know. There is certainly a stigma associated with hearing aids, and so it's sometimes very difficult to mentally get into the place of being okay with that. The cost of hearing aids is very high, as many people know, and unfortunately insurance does not cover hearing aids for the most part. So we know that cost is certainly a piece of that, but if we look at use rate in places like the United Kingdom, where hearing aids are covered by the National Health Service, the use rate is not much higher over there. So it's more than just affordability and access. I think the stigma is a big part of it.
Why is that? Why isn't it just okay to say, I don't hear very well, or my hearing's going, could you slow down your speech or talk a little bit louder, or let me adjust my hearing aid?
Yeah, I think it all comes back to that perception of hearing loss and hearing aids being associated with aging. And as more and more people are getting exposed to high levels of noise at younger and younger ages with music players and
headphones.
Headphones, we're seeing the numbers of individuals affected by hearing loss creeping down into lower ages. So again, while you do have a higher chance of having hearing loss as you get older, physiologically that just happens, it's becoming more and more common.
So who's a good candidate for hearing aids?
Anyone with hearing loss is a good candidate for hearing aids. But it's really important for that individual to be on board with the process. It's not a quick fix. It takes a lot of effort and commitment on the part of the person who's just been fit with the hearing aids. The auditory system needs time to adapt. It needs a consistent auditory signal. So it's really important that people take that step knowing that they have to be committed, wear the hearing aids full time, so that their brain can get used to what it's hearing. And it's only really then that you're going to see the most positive outcome and benefit.
Well, it's estimated that less than 15% of the individuals with hearing loss over the age of 50 use hearing aids. Why isn't the use higher than that? I mean, we talked a little bit about stigma, and you were saying that it's good to keep your hearing aids in the whole time, but I know in my mother's case, if she's on the phone, she'll take the hearing aid out, sometimes forgets them, has lost one.
Yeah.
So it's kind of a process.
Yeah, it is a process, and again, I think it comes back to that stigma. I think that it's really difficult for individuals to get to the point of accepting that there's something that's not as strong as it once was in their body. The fear of aging certainly is present, and the physical appearance of a hearing aid, some individuals just feel really uncomfortable with that. And I would argue that not treating hearing loss and not getting a hearing aid if you need one, or hearing aids if you need them, the appearance of untreated hearing loss and trying to bluff your way through a conversation.
You're not fooling anybody.
You're not fooling anyone, and you're responding inappropriately, and so that actually, to me, seems like something that's a lot more obvious than hearing loss.
And you're missing a lot.
And hearing aids. Yes, and you're missing a lot, and you're not connecting with those loved ones as well as you'd like to, and you might be avoiding conversations with grandchildren because you know you're going to have a hard time understanding them. Mm-hmm. They may live at a distance and you want to talk on the phone with them, and you're
right.
not able to do that. So you're really becoming more and more disconnected from things that are important.
So hearing aids are expensive, and you know, it's tempting when you see a commercial or maybe an advertisement for a cheaper solution, but you have to watch out for fraud.
It's really important that an individual who's looking for help and looking for treatment sees an audiologist. An audiologist is the healthcare professional that's the most highly qualified to assess and treat hearing imbalance disorders. And audiologists go through extensive training, lots of educational background. The current entry-level practice degree is a doctoral degree. So many years of education and supervised training. They need to pass a nationally standardized exam after graduating before they begin practicing, and they follow a strict code of ethics and need to obtain professional development. And so it's really important that whenever you seek out help, the person that you're talking to, you ask about credentials. If an audiologist is the best person to provide those services, some individuals in Vermont, across the country, can dispense hearing aids and not be audiologists. And so they don't have the same educational background. And so it's important not to see a white lab coat and assume that person is an audiologist, and actually don't assume the person's an audiologist if they're working in a physician's office. Ask the questions, ask about credentials, and make sure it's an audiologist.
We have a couple of minutes left. Tell me a little bit about UVM's Luce Center for Communication and the services that are available there.
Sure. We're a nonprofit clinic for speech, language, and hearing, and we are the primary training center for graduate students in the speech language pathology program. We provide, in audiology, we provide hearing services to assess and treat, and the treatment that we provide is much broader than just a hearing aid fitting. You know, a goal of treatment should not just be fitting a hearing aid, it should be a more comprehensive plan. So we do that. We get to know the patient, we learn about their priorities, their listening needs, their goals, and we develop a much larger comprehensive program. And so the evidence-based practice that we use based on research allows us to provide a team approach with the patient, and it really lends itself to a much better, more positive outcome in the end.
Well, I think that the big thing is to get the education, to find out what it is that's going on with your hearing, mm-hmm. and then, you know, as you said, come up with a plan mm-hmm. to work through that.
Mm-hmm. And the educational piece is so important for us at the Eleanor Luce Center, both for our students, graduate and undergraduate students, but also for those individuals who come in and work with us. We provide community outreach, we provide presentations. We want to get the word out about hearing loss and the negative effects of hearing loss to as many people as we can.
And, you know, help is available whether it's partial hearing loss or extensive.
Yes, exactly. Anyone who's being affected by hearing difficulties should be seen by an audiologist, at least for an assessment.
Mm-hmm. And so that would be the first step, you would say?
Absolutely. Get more information, find out what your options are, and go from there.
Okay. Well, I want to thank you for joining me today.
Of course.
That's our program for today. Thanks for joining us. I'm Judy Simpson. We'll see you again next time on Across the Fence.